Welcome to Echo and Encourage. I am so excited to have Akshay here with us today. Akshay has more credentials than are in the alphabet. He's got DMD, which is Doctor of Dental Surgery, MD, Medical Doctor, MPH, Masters of Public Health, and is it pronounced FACS or FACS?
FACS, yeah.
FACS. He is a fellows of the American College of Surgeons. And Akshay, he has a lovely wife, fellow speech language pathologist, and they have 2 children. And I first met Akshay in Hawaii on the island of Oahu. Would you like to share a little bit about how we met?
Sure, yeah. So I guess 3 credentials ago, I was doing a dental residency at Queen's Hospital in Honolulu. Excuse me. And Maria, that's Hannah's mom, was the dental hygienist for the clinic that I was working in. And so we worked together, but we also just got to be humans that interacted, and we each talked about our lives a little bit. I had actually just met the woman who's now my wife and mother of my 2 children. And so I, talked about her. And then you were a teenager. I think Noah was also a teenager, but I think he was maybe just turned 13 or somewhere around there. And so it was just fun to talk to your mom about thinking about things about schools for the 2 of you. Since you guys went through major changes there. And then as you got older and then went into speech language pathology, we sort of reconnected through social media, and my wife's a speech language pathologist. And so it's been really exciting to see you sort of develop professionally, and I've sort of stayed loosely in touch with your, amateur comedy career as well. Oh. And so, I'm just proud of you. It's been cool to watch you grow from, just a kid into a professional and an entertainer and a very thoughtful person and a chip off the old block. Both your parents are very energetic, caring people, and I'm happy to know your family.
Oh, thank you so much. Your words are so kind, and I am so honored to have you here and to hear you share all of that. It reminds me, my mom shared with me once that when you were completing your dental residency at Queen's, mm-hmm. you wrote each coworker the most thoughtful note that it just meant so much. My mom treasured your words. You have a gift of encouraging people and being so thoughtful and kind. So thank you for all that you do.
Now, the funny story that's a follow-up to that is somehow the note to one of the assistants got lost. And to this day, I don't know what happened to it. And it was weeks later that one of the other assistants came up to me and said hey, Dr. Govind, Jenny didn't get one. And I was like, what? Are you kidding? I don't know what happened to it, but, Jenny is very dear to me. I actually got to go to the first birthday of her daughter, who I saw Jenny just a couple months ago when I was on Hawaii for some other reason. I went and visited the old clinic. Jenny was there. Her daughter is I don't know, 16 now or something, and maybe 15. I can't remember. And Jenny's now the most senior person in the assisting department there. And I also got her a recipe for chicken adobo some years ago and made it. And so that's the funny story there, is that hers got lost and she was sad for a moment, but we cleared it all up. We're all friends now.
Aw, that is a funny story. Jenny has so much life in her. I love her personality. I'm glad you got to see her recently.
Me too.
Yes. So what got you into dentistry and then MD?
Yeah. So when I finished high school, I knew I loved music, but my first major decision in adulthood was whether to do professional music or not. And I always wanted a family. I always wanted to really be there for my children. And two parts of musician life are really not as predictable for that. One of them is, even if you are successful, there's like a ton of staying out late. There's a ton of like just irregular hours. And then that's if you have gigs all the time and make it work that way. Now, there's subtlety to how to do it as a day job, teaching, recording, blah, blah, blah. But anyway, that was my thought at the time. And then, but there's just a tremendous amount of sort of unpredictability of whether your work will be recognized financially. And there's a bunch of stuff that costs money in the world. And it turns out I have all these other interests. So it was okay for me to explore those other things and still be a musician, still love my music. And so when I was in college, I was initially an undeclaredologist, strictly undeclaredology, until they told me I couldn't do that anymore. And then, so I was studying lots of different stuff, and I ended up double majoring in philosophy and chemistry with a minor in music. And I figured I would be a chemist because there's no such thing as being a philosopher, and I didn't want to go to law school. And then I had like one course left in my chemistry degree, and I realized I just had no interest in chemistry. It wasn't that I didn't like the content. It's just that there wasn't really a human component to it, and I sort of recognized that that I desired that I thrived on that I was good at it. I'm a naturally sort of personable individual, and I love the stories of people, and I like that being part of what I do, and I can create those relationships in a way that I think is meaningful to me and can be therapeutic for other people. So I started thinking about it. My mom's a physician, actually. She just retired from family medicine about 2.5 years ago, and she had practiced for 42 years. And I didn't think maybe I wanted the commitment of general medicine at that time. And I sort of got the idea, I wonder what dentistry is like. And I called the dentist that I'd been going to since I was a kid and asked if he had time to get a cup of coffee. And we sat down, and he kind of told me, yeah, it's a great field. You get to work with your hands. You get to work with people. If you want to be your own boss, you can do that. If you want to specialize in something, you can do that. If you want to do, family dentistry for, and see people for years and years, then you can do that. And so I was like, okay, that sounds pretty cool. So I had some prereqs to take, and I took those, and you got to take the tests, and, I'm good at school and tests and stuff. So I did all that. And then I applied to school and got in, and I really only knew like a modest amount about dentistry when I started school. So I really learned a lot about the field during my initial training. I knew that I wanted to do that general practice residency, the one that I met your mom at, just because I wanted to have a lot more experience as a generalist before deciding if I wanted to continue in general dentistry or if I wanted to specialize. And then my time in Hawaii, actually, did you ever meet Greg Lung? He's one of the oral surgeons there.
If he was at Courtney's wedding, yes.
I don't know if he was at Courtney's wedding, but I would say he's someone, we had like a facial trauma case, and it was, 10 hours long, and you got to, peel the whole face down, fix all the fractures, get into the eye sockets, both jaws, all the everything. It takes all day. And after we finished it, we went to go get a bite to eat, and he sat me down, and he was like, look, I know you're thinking about general, thinking about pediatric dentistry, thinking about all these things, and you can do whatever you want, but you've got to do surgery, man. Like,
Wow.
He saw in me that kind of higher intensity of work brings out the best in me, and that I can bring a lot to the field. And like that, there's mentorship that comes from that. But at the time I was like, oh, I was flattered. That's very kind of you, Dr. Lung. But like, come on, I'm not going to spend that many more years in training. I got stuff to do. And so I was a general dentist. I worked at a little community health center on Molokai. Actually, the whole island has just 7,500 people. I was one of 4 dentists there. And they're sort of like, I'm working on some lady's tooth, and, we do the filling, and, you check it with the floss and make sure it's all good. And then you put the mirror, do you like the color, and in that time, like everyone's favorite guy on the island kind of comes in with a big swelling out to here. And I had to decide, can I help him today, or do I need to get him on a helicopter to another island because there's no oral surgeons on the island? And, I looked at him, I looked at his mouth opening, I looked at, just how healthy he was overall and how sick he was from this. And I was like, okay, I can treat this guy. But I had to make all these really important decisions in a matter of just a quick glance. And then, so I was like, okay, cool. Like, I'll get you in the next 10, 15 minutes, get you taken care of. And then I go back and I'm like adjusting the bite on this filling that I was just finishing up. And you're just like, all right, tap, tap, tap. And it's so boring. And then I'm hearing, Dr. Lung's voice in my head. And I'm like, darn it, you're right. There goes like the next decade, right? Like just prepping for surgery and then doing the 6-year residency and fellowship and then all that. So, but that's what happened. And
wow,
here I am on the other end of it all.
That's incredible. That sounds so pivotal. And I'm trying to bring back my memories. Was this Dr. DeLong, who was married to someone with the first letter was B, like Brenna or?
No, his last name is Lung, like the
Lung.
Breathe with. His wife's name Connie.
Nice. Okay, thank you. That is so beautiful. That is incredible that you were able to know right in that moment that you wanted more out of your career than where you were, which for many people, I'm sure it is a fulfilling career being a dentist. My mom always says, as a hygienist, go be the dentist. But you were ready for more. So do you have a photographic memory, or you don't have a photographic memory?
I do not. Yeah, I am a very abstract thinker. And so for me, the way that I remember large amounts of information is by creating associations and by like having stories through which I think through things, or from like understanding a concept and then applying the concept. So in that way, I'm actually not like the fastest absorber of information, but then as I absorb information, I tend to be able to like put many different pieces together. So then once it's all there, then it becomes like the network of stuff that I can reason through.
Yes, that's beautiful. And that gives so much hope to people who are interested in furthering their education and they might not have a photographic memory. You've just proven that it can be done. And it kind of reminds me of music, how there's different songs and notes, and then putting it all together makes the rhythm and the beautiful piece. What type of music are you into? I see guitars behind you.
Oh, yeah, there are guitars behind me. I guess there's also a banjo right behind that. I'm not a great banjo player, but I would say most of my music starts from jazz, but goes lots of different directions from there, including rock and country and soul. And, I'll just say, I've also got a little drum kit over there, and upstairs we've got a piano. I'm really first a piano player, but guitars make for cool decoration on the wall. And then when they're on the wall, then I just pick them up and play them. Whereas if they're away in a case, then I don't. So
that's awesome. Do you write music?
Oh, I do. Yes, absolutely.
Wow. Have you published any songs, or is it just for friends to hear?
Oh, anyone can hear my music. Yeah. So I have some like old music that's not really necessarily accessible on the internet, but I've been meaning to, put together an archives collection. Maybe that'll be my goal. We'll set a goal for that. Actually, let's do it right now. Let's say by the end of 2024, I'll put together an archives album. Now, a lot of it is like, kind of whiny coming of age music, but that's what happened at that time. But more recently, I put out an album a little over a year ago with a friend of mine. And if it's okay with you, I'll tell the story.
Yes, please.
So, during my surgical training, I really did very little performing because typically, just depending on which part of my training, I was typically working like 60 to 100 hours a week, like every week for like 7 years. And so and in that time, I also had my first child, and we moved a couple of times, and so there wasn't necessarily like a lot of time for anything other than get a little bit of rest when I could, try to stay like a reasonably in touch spouse, and then when we had my son, to like do whatever I could to be involved in his young life. So by the time I got through my training, which was 2018, I was 37 years old. I was like, all right, cool, like time to book a gig, right? So there was this little music store / club that I passed by between where I lived and where I worked. And I just stopped in, and, with that Govind charm, I just kind of talked to them and said, hey, I'd really like to book a gig here. And like, well, like, what do you do? I honestly can't remember if I like gave them some old recordings or if I just sang a song right there. But either way, they're like, okay, cool. Like, talk to our booking person and set a date. So I did that, and I'm like, well, I'm going to need a band. So one of the ways that I had been recruited for a band when I was in college was there was someone who like worked in the music library at UCSB where I went to college. I've got my representant right here. And he knew that I was a piano player, and he gave my name to these ladies who were, about 10 years older than me, 10, 12 years older. And that's how I joined this band. We were called Creme de la Femme and the Sensitive Men. That album is available online. It's just a live album. If you search for Creme de la Femme, it's on Spotify and Amazon and all that. So anyway, I was like, okay, I'll just go to the local college and talk to their jazz program and find musicians that way. So that's exactly what I did. Reed College was right near there. I found their jazz director online and said, I've got this gig. It's going to be a half an hour set. We need 2 rehearsals. I need a bass player and a drummer. I'll pay them each $100. You got some people? And they set me up with this guy, Eli, who played drums, who's also a pianist and a composer. And then this guy, Nick Hill, who's basically me when I was, 20, 21 years old. And he was also like a non-music major, but like very into music, multi-instrumentalist. And so we rehearsed for this gig, got to be really good friends, actually like stayed out all night, the night after the gig. It was great fun. So then pandemic happened. I moved from Portland where this all happened to the East Bay of Northern California. And it so happened that Eli's parents were from this like 20 minutes away. And so when he finished college, he moved to this area. So like our COVID project was like, literally we only saw each other outside of our families. And we decided to like start working on this album. And literally like the whole thing was recorded. Like we were wearing masks, and it was like just the 2 of us in this garage. And so anyway, the album's called Friendemics. It's the Friendship Pandemic Mix. And the band name is AE. Like, that letter, that's the connection of the letters A and E. I guess it's technically called ASH. But it's like an A and an E because my name's Akshay, his name's Eli, and we did it together. So
Yes.
anyway, so that's Friendemics, available on all your favorite streaming platforms. So
That is so creative, and what a way to come together during such a horrible time in the world and then make beauty out of it.
totally.
Whoa, this is very inspiring. I can't wait to download your album.
Cool.
And I like that A and E. It kind of sounds almost like a pun.
Totally.
Yes, this is awesome.
And
I see.
The next album is going to be the kids album. And that is like basically all stuff that I've either composed with the kids or about the kids. Some highlights that have been written but not necessarily finished yet. Like there's a song that we sing to my daughter when she's throwing a fit. It's called "The Saddest Baby in the World." I'll sing you a little bit. It goes, "The saddest baby in the world, the saddest baby in the world. How did this little girl become the saddest baby in the world?" That'll be stuck in your head for sure.
Oh, that is so precious.
And it goes through all the silly things that she's crying about. And she was like 1 when I made it up. And then there's one about how my son, when he was born, he was grabbing his umbilical cord and cutting off oxygen supply to himself. So that's why did you grab your cord? And then there's one made up with my niece, it's called "Can't Stop Dancing in the Fairy Ring." And then the most recent one, which my son goes to a co-op school, and we do janitorial work every third weekend there. And I was working in the art room with a 5-year-old named Athena, and we made up "Mopping Up the Art Room." There's a little call and response, "Getting it clean, getting it clean." I said, "Mopping up the art room." So that's the album that's in the works there. So.
That is so cheerful and creative. This is wonderful. I think my speech therapy kids need to listen to this. And when it's time to clean up, that we can play that song. Yeah. And when it's time for them to go to the calm corner, we can play the first song.
Totally.
It's so sweet. And I think that that's so unique to be able to be so musical and make time for that when you have such a fulfilled and booked career. So how do you do that? How do you find time to be a dad, husband, and musician and your current career?
Yeah, well, this is sort of like, this is the content, right? This is what it's all about. And people have a certain amount of bandwidth, right? And we sort of have to be like true to what we can sustain. So I am lucky in that my bandwidth is really a lot. I typically wake up at between 4:30 and 5 in the mornings. I'm typically it depends, roughly 3 days a week I swim in the morning. So I'm usually out of the house by 5:10, 5:15, in the pool 5:30, out of the pool 6:30, showered 6:45, morning conference 7 or 7:15, depending on the day. And then I just do all my work and then come and do all the stuff at home and then do whatever I need to do and then just do it again. And I've just done that for 25 years. And that is not sustainable for most people. I sort of recognize that. But I've been sort of blessed with this ability to just keep doing all the stuff and just keep on doing it, right? I think
yes.
the answer to how I do it is that, and this is the thing that's sort of more broadly useful for other people that are like, okay, well, I guess I'm not going to be a surgeon, right? But whatever it is that you are doing in one sort of arena of your life, when you are doing something else, it's optimal to find an activity that is still meaningful and fulfilling, but the energy spent doing that is restorative for like the thing that you need the break from. So like I couldn't just do any of the things that I do all day, every day, and still have the energy to keep on doing stuff. But like I'm a social person. I love staying in touch with people. So like right now, you know, being on this thing with you, like it's bringing me joy just to see you, talk to you, be in touch with you, someone that I care about but don't talk to frequently. And that's restored. You know, I'm on call this week. I've got a couple sick patients in the hospital. I made sure they were tucked in before leaving the hospital today and coming home. And I am stressed about them, but this activity is like really fun, is really restorative, and is also meaningful. And then, you know, I'll finish this and I'll putter around, do some dishes, do whatever, get to bed early, get in the swimming pool tomorrow morning. And then I've got a textbook chapter to work on after that, and then check in with the family, go to the park, do whatever. So I'm always doing stuff. There's a lot of executive planning, like executive function stuff that goes into like, what are the deadlines? What needs to go on the calendar? When I was a younger person, I was a much more like improvisational use of my time. And I'm still very adaptable like that. Like if something doesn't go according to the calendar, I'm fine to just like go like, okay, that's not going to work. We have to change it. Now it's going to be this, that, and the other. But I'm busy enough now, and I have like enough other people that need coordinating with that I have to live by a calendar. So I sort of not regretfully, but begrudgingly do that.
That is so beautiful to find something that restores you, and then that helps fill your cup to fuel you for the next day. That is very good advice. Yeah. Mic drop, but we don't want to drop these mics.
Totally. Yeah. Oh, but I do go to bed early. Like as soon as I'm done with stuff, I go to bed. I definitely don't watch TV. It's sometimes, you know, to the chagrin of my wife, because she enjoys some shows and wishes that I would watch them. But that's it. Like there's a ton of stuff out there, ton of content. And if you get into like much of it, then like that's just time that you don't have for creating your own. And I have too many interests, too many ideas that I need to, and like whether that's like academic things, textbook chapters, papers, research, or like silly songs about dancing in a fairy ring, like those are more important to me. And so I very sort of deliberately like don't really get into shows and stuff, because you can lose everything in terms of all of your free time on that. So
that's right.
When I finish like stuff that is going to be useful for my day, I am off to bed, usually before 9, and almost always before 10. And then that way, like I get enough restoration before my 4:30 or 5 wake ups. And I wake up at the same time on weekends as I do on weekdays. It's just always the same. That's the schedule. Maybe 6.
Do you set? Oh, maybe 6. Do you set an alarm, or does your body wake you up?
I don't set an alarm. No, I just wake up. I sort of lighten. And actually, like on Tuesday, I had to go down to San Jose, like an hour away, for a dinner. And then the Wednesday, I was like a workshop instructor at this like anesthesia conference. And so that was like all day Wednesday, and then drove back through traffic and rain. And if I'm honest, I didn't wake up in time for my swim on Thursday. And guess what? That was okay, because I was tired. So
yes, your body let you know what you needed.
Totally.
That's so neat that your body is so ready to tell you what it needs, and you listen and it works out.
Yeah.
I wonder if I can train myself to do that eventually.
I think the key is like you see what time you need to go to bed in order to wake up whenever you need to wake up. And then kind of like that's like what do you need to do? And it's also like the other thing that matters is like when's your time of productivity, right? So for me, my highest yield productivity is first thing in the morning, basically like between 4:30 and like 11 a.m. is when I'm going to get like good work done. And it's also like relatively quiet. Like the kids are just not up. And so I can get some stuff done if I've got like, if I wake up at 4:30 or 5 and no one else is going to start stirring till like 7:30, 7:45 on a weekend, then I can like put in a couple hours. And then when they do wake up, then like, okay, let's go make pancakes and just have some family time, do some fun stuff. So, but then I'm like not feeling guilty about it because I already got the stuff done. Or like you get a workout in early in the morning and you're just like, okay, cool. Whole day, like that one's checked off. Like today I did not get a workout in the morning and I'm thinking about it. And then after work, I had to go pick up my son. We spend time in traffic. Everything's ruined, you know. It's not really good, but it's just better. The workout's done.
Yes.
So.
Those workouts help me feel so much better,
Yeah.
and it releases those good hormones, right?
Absolutely.
Yes. I see that you did your fellowship in Craniomaxillofacial and Trauma Surgery.
Yeah.
And I was wondering, is there anything that you would not do after seeing patients in all of that come out through trauma? Any tips for our listeners where you're like, just don't go there?
Yeah, I gave up motorcycle riding.
Oh, okay.
And you know, I rode a motorcycle without incident from age 19 to 36.
Wow.
And, yeah, there are a few years in there where I didn't have a motorbike, but basically that means like I win, like game over, I win, right? So all good. No need to play that game anymore. And then, you know, once I had kids, then I was like, okay, I can't justify this. So that's the main thing. I definitely always wear a helmet when I'm riding a bicycle. Riding a bicycle is dangerous also. But there's also like more benefits in terms of, you know, health and camaraderie and all that. So, it's still dangerous. I acknowledge that, but less dangerous than motorcycle riding just because of the speed.
Yes. Wow. I can only remember I was on a motorcycle once as a young girl and I wore a helmet and then was told to never do that again.
You were told never to ride the motorbike again.
Never to go on a motorcycle again. I think one of our church members, their older kids, let me try it out. And now, instead, I scuba dive, which probably isn't the safest, but once in a while,
Sure.
I've done that.
Well,
I'm
go ahead.
thinking about retiring that.
I see. Well, I don't know that much about scuba diving, but I mean, it's a different risk profile, right? And it's probably not good to scuba dive alone.
Right.
And,
always have your safety buddy.
Yeah. There's probably other things, but I don't know them. What are some of the safety things you consider whilst scuba diving?
Well, I remember scuba diving in Florida, and I was the only one that wore a full body suit. And my scuba partner got stung by jellyfish, and we were down there, and it was hard to resurface because they kept getting stung.
Oh my gosh.
But I was protected, thankfully. But it was like very scary to see them have a reaction and need to get out. But the jellyfish were everywhere. So I know there's one maneuver where you can, like, I think take part of the equipment and then help move the jellyfish out of the way with like the air bubbles. But in that moment, I was kind of, you know, a little frozen.
Yeah.
And so that was a little scary. Also seeing an eel pretty close, heard some stories where the eel has pinned down people. And then you either have to keep getting more oxygen tanks from other friends until the eel lets go, or cut the eel. And so I made sure to, you know, get away from the eel as soon as I saw that. And then, of course, you've got to do your safety stop before you resurface. So there's different things with that, and, you know, sharks and gators, depending on where you are, and the current. It's just, I love the pressure of the water, and it helped my headaches from post-concussion syndrome. And it helped a lot of the veterans that trained me who also had headaches from post-concussion syndrome. And so something about it just really, at 67 feet for me under and 100 feet and under for them, I could feel so much relief from headaches. Since then, I've don't have those headaches. I wear the acupuncture ear seeds and do stress management, and had a recent healing on a cruise with acupuncture and prayer. But I sure love scuba diving.
Cool. Well, thanks for sharing that. I'm sorry to hear about the concussion. How long ago was that?
Thank you. That was 2012. It was a direct impact, and the bump is still on my head.
Wow.
Yeah. Executive functions was definitely targeted in speech therapy, and that's when I decided I wanted to become a speech pathologist.
Cool. Yeah, everyone has their aha moment, right?
Yes, you're right. Akshay, are there moments in your career where you've seen either medical miracles take place, or you have seen people's compassion for the people going through a hard time help their recovery?
Well, let me think about that a little bit. I mean, I don't know the extent to which you've followed the history of Western philosophy, but I'll refer to the great David Hume for his description on miracles, and I sort of I won't go far into it, but I'll say I'm not really much of a miraculous thinker, but I will say that mindset matters a lot for recovery, and this is probably like most literally sort of laid out in things like cognitive behavioral therapy, where something about the mindset or the beliefs or the thoughts and the behaviors is all not working and everything's spiraling, and you can't necessarily control the feelings, you can't necessarily control the thoughts, but you can control the behavior, and then the thoughts and the feelings tend to at least start working in the right direction. That's the concept behind cognitive behavioral therapy. And the same is definitely true of, the show of compassion and the human connections that are part of healing. And I think this is a critical part of sort of what I try to do in all of my work with patients. The patient I'm thinking about in the hospital right now, very, very, very sick. And I probably talked to his daughter for a total of 20 minutes. And, there's probably like 5 minutes initially, like 14 minutes prior to surgery for like all the stuff that we were going to need to consider. And then 1 minute immediately after surgery to tell them that like everything went as we planned and he's still critically ill and we're going to continue to watch him. Right. But like each of those moments is like really important to me in terms of like this, and this family member, kind of said to me, like, after we sort of had the expected outcome, she's like, oh, I'm like taking my first breath. Right. And so she needs to like have the ability to recover over the night, to just be able to like rest her eyes and then be there for her dad, to work through. He's going to have a really tough hospitalization. And one thing a lot of people don't really appreciate is that when patients are like in intensive care units, and maybe they're pharmacologically sedated so that they can't really interact, a lot of times they actually still are very much hearing what people are saying, but it becomes very challenging as a doctor or a nurse or any other provider. I mean, you did SLP rotations in the ICU, I'm sure, and you were assessing swallows and whatnot. And there are times where you're like, okay, this person isn't interacting at all, it can be hard to talk to them and hard to remember that they're just sort of like a person doing their whatever. But someone when I was in medical school really impressed upon me that they often can hear and they can interact, even if it's like a tiny bit. And if you interact with them, then it's meaningful. And I will direct it. So there's I think it's a Moth podcast, and the doctor that gave the talk goes by T. She's since passed away. It's really sad. But she describes a bad trauma victim that she took care of for like a year, for some really, really long time. And sort of the punchline is that a long time later, she was rotating through, and this young lady like came up to her and was looking great and was like, "Oh my God, it's you! It's T!" Like, and she realized it was this patient that she had been taking care of who like had 6 different things that could have killed her, and she's like, "Wait a minute, you were unconscious. You had your eyes closed. Like, how did you know it was me?" She's like, "I heard your voice. I recognize your voice. You are the one who always talked to me." I still choke up thinking about it because it's not like that doctor did that because she knew she would get that feedback. It's just because this is when you're taking care of a human who's in a terrible situation. Why would you not talk to them? And that's so powerful. And you have to look for that one and find it. If I find it, I'll send it to you. But it's really a life-changing 15 minutes or so to hear that description.
I believe it. I'm tearing up and I have chicken skin.
Cool.
Oh, that is incredible. Yes, it's so neat how there can still be hearing even when the other sensory and motor nerves just don't seem to be firing in that moment. Wow. Yes. So compassion and mindset, those are 2 huge things that are supportive for the healing recovery journey. Thank you for sharing that. I see that you received your MPH and DMD from Harvard University. Did you do those degrees simultaneously?
No.
Or one at a time?
One at a time. It was sort of like, again, I didn't know like that much about dentistry before I went to dental school. And I guess they let me into Harvard because they saw my like kind of like teaching and academic background and potential. And I feel like I'm, doing my part in that. I'm a residency program director now for the program in Oakland, California at Highland Hospital. But I started dental school and I was just, learning what dentistry was and doing all this stuff and making friends and having fun too. And then I knew as I was getting toward the like last 1/3 of dental school that I'm very much a big picture thinker. A lot of dentists are very sort of detail oriented. Not that I'm not detail oriented, but I'm far more interested in concepts and like big picture stuff. And like I pay incredibly close attention when I have to for a, for a surgery, whether it's lining up a lip or, an eyelid or like whatever needs to be just perfect in order to be right. But it's not that interesting, right? Like after you've like, done a whole bunch of these things. So the same was true of teeth. I was like, okay, like, I want to do a good job on the dentistry, but like 1 tooth at a time is so micro. I really wanted to, and like, if you know anything about access and like reimbursement, like America has got a long way to go in terms of getting people good access to care. So I knew that 1 tooth at a time would always feel too micro for me. And I really wanted to understand health systems, but I was just starting to like get my hands under me, where like I understood it and I like wanted to make it happen. So that's why I did the general practice residency immediately after dental school. And then I had applied to public health school and I had gotten in. that year, but that's also the year that I met Carly, my wife, and so I made the sacrifice to stay in Hawaii for another year while she finished her program at UH. And actually, that year was the year that I was in Molokai, where I had my aha moment that made me say, okay, I want to do several more years for surgery. But then I had already gotten into public health school and then deferred for a year to hang out with Carly, and then went back to Harvard to do the public health degree, which my focus was community health, which remains my main area of interest. And then it was always the plan to work in education and in community health as a surgeon. And so my residency, included like all the clinical training. And then I still kind of had that sense that I wanted to be really good at it when I was feeling only like okay at it. And so I did the fellowship and got the extra experience. And but what I get to apply in my public health understanding is really these like systems level things. And I work in a health system that's sort of medium-sized county system. And I've like gotten to know people all up and down, from the CEO to the environmental services guy, who vacuums. Like I know them, I see them around, we say hello. Like they do a thing where you can go for a walk with the CEO like every couple of months, and I take the kids. My kids know the CEO of the health system. We walked around Lake Merritt, and Norman's the guy who vacuums, right? So and then everyone who's in graduate medical education, like we work on papers together, we organize rotations for our residents together. So it's really been great to sort of be able to do all the interesting things that I've studied clinically, and to work in a health system that's sort of the right size for me to have an impact over time. And, I sit on some committees, and some of the work that I do is in like equity, not only for patients, but also for people who want to enter our field. There's a ton, like my field is over 90% men. Like we're really trying to tear that down. And we hired a really awesome woman faculty this year. And so hopefully that will make our program just like, more appealing for the young women who want to go into surgery too. So.
Yes, diversity is so important. Thank you so much for advocating for women. I know we're recording right now on International Women's Day, so that's really neat. And I know the episode will release after that, but what a beautiful way to advocate for women. And I love how your community is so close and vibrant. The person who vacuums where I work has now left this week, and we're all very sad. And so I just love how there's diverse people, diverse jobs, roles, and everybody works together and has this really beautiful community.
Yeah, well said. Oh, I have a funny story. And so as I mentioned, my mom was a physician. And I was, and like when I was a real little kid, my pediatrician was also a woman. And I remember I must have been like 6 or 7 years old. And I met a friend in elementary school whose dad was a doctor. And that was the first time that I ever considered the fact that men could be doctors.
Really?
I hadn't met one before. I guess I probably had, but I never thought about it, right?
Yes, that's awesome. That reminds me of, I saw somebody on social media whose husband is a chef, and she was cooking one day, and the boys said, "Mommy, why are you cooking? That's Daddy's job." Like just how it depends on how you're raised, how you can see that there can be different ways we can all support and be.
Well, I'm interested,
so neat.
as like, I'm not a religious person, but I know that you are, and the different organizations within the church sort of have different takes on it. But there's certainly historically, there's a lot of gender roles in your culture, and I'm interested in your take on it and approach to it as somebody, sort of faith.
That is a really good question. So I grew up Seventh-day Adventist and keeping Sabbath, celebrating Sabbath, Friday night to Saturday night, sunset. And there are some things within the church that I would like to challenge, actually. For example, women's ordination. So I believe that right now they have it where the male pastors are recognized and ordained. It's like a special prayer that they do, and they recognize that they're the leader. And then I think that might even support them financially a little bit more. But throughout the Bible, men and women share God's word and love. And so I hope that someday there can be more discussion on that topic, and that the church can ordain women as well, because I believe that the sooner we get the good news out there and encourage people, the better. And I feel like it's a closed mindset to take certain Bible verses and just say, no, this is only for men, instead of including women. Just seeing how when Jesus was raised from the dead, even the first person who was a witness to that was a woman outside of the grave. And back then they didn't take eyewitness accounts that seriously from women, but Jesus is like, no, I'm going to show that I want women to speak. And he told a woman. And so I just see that throughout scripture. And so I hope that someday that we can grow in that. I haven't read the minutes or anything from the last general conference on that, but I want to follow up on that, and I would challenge that. Also, I have guest preached at different places, and I've heard from other women that have preached, it might have been in the denomination of Seventh-day Adventists, or for sure other Christian denominations. Sometimes the men have left the room when the woman went to go speak, and only the women stayed. And the person who told this story, it was, I'm not sure if I remember exactly who it was. I think I know, but I'm not going to say it. I went to their conference recently, and at first she was very like hurt or offended, but over time she was like, you know what? I'm not going to be offended or hurt. I'm going to meet people where they're at. I'm going to keep preaching and sharing and showing up for whoever's receptive. And I think over time, the people open their mindset, but still today, I think there's pushback from certain denominations about women preaching. Thankfully, I was well received. I guest preached recently at a church and even shared a little bit about my divorce I'm going through and God's heart. Oh, thank you. But yes, but thankfully, I'm able to be a voice on this and speak about God's heart and how it's postured towards women and men that go through divorce, and the different grounds for divorce that some Christians take out of context. Not everybody recognizes certain forms of whether it's emotional abuse, verbal abuse, different things like that. They only recognize infidelity as grounds for divorce, but they don't read the scriptures about if the unbeliever departs, let him depart, things like that. So I really feel like I'm called to be a voice on sharing what the Bible says in context to support people that are having to exit marriages. And not all Christian denominations approve of this. I recently spoke with someone, for example, who's Catholic, and they told me that they would only want to date me in the future if I proved to their priest that it was called for an annulment in the priest's eyes. And I said that that I only go by what, the Bible says, what God says, and I'm not here to prove to man anything that he calls me to. So living out of this lens of believing that the Bible and history match, but also this lens of I want to advocate for women and men and share my story and encourage people to be bold in their faith and challenge different ideas of thinking is where I'm at right now.
Yeah. Thank you for sharing that.
Yes.
My sort of follow-up questions to this are what do you do? And you don't necessarily have to have the answer to this, but the Bible's a long book, and it's not all written by one author, and so there are things that if not absolutely contradictory, or at least like able to be interpreted, like, hey, this part kind of says it this way, that part kind of says it that way, does either of them matter in isolation, or like what's the overarching theme as you like put it in the context of the everything, and then that's just someone's opinion, and so people are going to disagree about that, but like whatever. Let's just say that there's something about your life that like the mass of interpretation of the Bible's words on it is different from what you feel in yourself, in your heart. I think that's probably, like I said, I'm not a religious person, but to me, that would be probably the hardest conflict to resolve. If I felt like something that I believed based on my experience in this situation and all of what's made me who I am is just different from what it says. And certainly, you will encounter things like that, but if they're sort of minor things, then you sort of deal with it and move on. But in major things like like a marriage or just a really huge life choice, that seems very, very stressful to me. And I wonder if you can comment on that.
Yeah, you're so right. Yes. So I grew up with Catholic grandparents that were very, very by the book. And then I grew up with Adventist parents who view the Bible out of a lens of the gospel and grace. And then I grew up with a lot of different church members and their opinions about things. And I found that I had to just study the Bible on my own and look at it in the context as best as I could. So like comparing the different Bible stories and then looking at the themes of them, kind of like how you were talking about, not just honing in on one filling, but on honing on looking at the big picture and how do the themes correlate and what is the message there. And so looking at those overarching themes, especially with the topic of divorce, has been helpful. Also researching from what other people have found. Patrick Weaver Ministries really helped me. He broke down the different Bible verses about divorce and letting the unbeliever depart if they don't believe, and what it looks like to depart from a marriage covenant, and debunking that Bible verse that says that God hates divorce, and realizing and researching that it actually was when God was talking to these men who kept cheating on their wives. And then he was saying, my heart hates divorce, like your behaviors. But people take that verse and they say to the woman who is needing to exit a marriage, and they say, hey, God hates divorce, so what are you doing? Like, you better go back. But that's not what God was saying. He was saying that his heart hates what's being done to them, and then they have to end up leaving. So when I unpacked like the context behind who he was talking to, and then I saw that in context, and then I was like so freed from that one thing that's so used out of context. And I have had mostly supportive people in the Christian church with what I've gone through. The most pushback that I have had is from some viewpoints that think that a priest needs to say it's no longer a thing. It should be annulled. But that is not the viewpoint that I take, because that's not I don't believe it's definitely not the Seventh-day Adventist typically viewpoint. Now, I would like to say that when we all get to heaven, we're not going to be like a bunch of Adventists having a party. It's going to be so diverse with people of all, in my opinion, people of all faiths or denominations that are searching for truth. And I believe all truth is God's truth. And so I have gone back and forth in my head, how do I best relate my beliefs to people that I interact with? Because when I'm in heaven, I'm not going to be going around and saying that I'm Seventh-day Adventist. I'm going to be just so happy to celebrate and share joy and the God's heart and love. So I do go back and forth here on this side, and I'm thinking, how can I best relate to people? But I think the reason why I stick with saying I'm Seventh-day Adventist is because so far from what I've looked at, it's the closest gospel-centered viewpoint denomination that I can find that aligns with the Bible, even though I do not agree with the whole women's ordination thing. But I'll still be challenging myself. I'm in a theology meets creativity cohort this year. It's with a bunch of women from different denominations, and we just unpack the Bible in Genesis. So I'm always on this journey to learn more about the Bible and how it connects. And so I'm open to how to describe all of that. But going back to the whole, how do you relate to things when people's or the viewpoint is pitched one way, but then in your heart it's different? I think it goes back to discernment and really having this like tight relationship with the Holy Spirit. For anybody that views Christianity or the Holy Spirit as something, I think that discernment helps you keep digging deeper, and then it illuminates the themes that other people actually see as well. And in our church history, I don't think they stuck up for people having to exit marriages very much, but thankfully in the recent years, there have been support groups. There's been people that advocate and resources to help people, but still across Christian denominations, there is this heavily shamed viewpoint of if you leave a marriage or divorce, just a lot of shame attached with that. And that's not what I'm seeing from the biblical standpoint when it comes to exiting due to any type of abuse, emotional, verbal, financial, spiritual, sexual, or any type of infidelity, things like that. And so I think it's good to keep challenging your own viewpoints and look at themes and research resources that help people have fulfilled lives that are safe and truth-filled, and that will guide breakthroughs. Yes, it has not been easy.
Yeah. Well, I'll be thinking about you and just wishing you all the best, because you've got all of the things to consider in the relationship, and then there's also a tremendous amount of logistic stuff to sort through, and then there's the ripple effect on whatever friendships you had together, and if there's some people like to assign blame and get get stuck on that, and that can not be interpreted the same by all people, and maybe some people get part of a story, some people get another part of a story. So I just I say all this just to acknowledge the magnitude of an event like that, and just to say thank you for sharing that with me, and that I'm thinking about you, and you are doing that because you know that in the long term it is the right way for you to be who you are and be in the right environment to um, like go after the things that are important to you. And I don't know what your plans are with with your former partner in the future, but whatever they are, like that's for you to decide. and you may decide it jointly, or you may decide it independently, and you may involve others in that. But like those are all the things that you have to spend your executive decision making time on, is like, how do I go about deciding this, and like, what's the reflection time that I've had to see where I fall in this, and then how does that compare and contrast with like the views of my family members, or my community members or church members, and to what extent do I need to do what's in line with what they expect versus do something different. And if I do something different, then to what extent do I need to reconcile those differences with the different groups of people? So it's just that it can be exhausting, all encompassing. And I think you don't need me to tell you any of this, and you don't need me to give you the permission to decide where your bandwidth sort of starts and stops and all this. But I'm just trying to normalize the experience of like maybe decreased productivity and lots of other things because of the amount of bandwidth necessary to make all of these decisions, internal and external.
Thank you for your compassion. That is so loving. This is great. This is real life. This is transparent and vulnerable content.
Yeah, for sure.
Yeah. Yes. Thank you so much. Akshay, would you like to have any listeners reach out if they have questions, or are you only available if people find you in research?
No, I'm always happy to. I mean, if there's anyone who feels like something that I've said resonates with them, or they want to run something by me. I mean, I am busy, but so if I like maybe don't get the first email, then just send it again. It's okay. But yeah, like I love people, and in the end, like what makes our lives so meaningful is connections. And so if there's somebody who feels so moved as to want to reach out, I would absolutely invite it.
Awesome. Would you like to say your email, or would you like me to put it in the description?
Probably, yeah. I mean, I guess I could say it. Yeah, sure. It's got, you got to spell it though, and then all the so it's akshay.govind.dmd@gmail.com, and I'll spell it's AK as in kangaroo, SHAY G as in George, O V as in Victor, I N as in Nancy, D as in David .dmd, like dog Mary dog, @gmail.com. So but yeah, by all means, you can put it in the description, or people can contact you and you can reach out to me, or whatever it is. There's lots of different ways to get in touch these days.
Awesome. Thank you. And what is one way we can echo eternity or encourage others?
I was supposed to think about this one ahead of time, wasn't I? What's the question again?
Oh, it's okay. It was just, are you comfortable with me asking that type of question?
Echo eternity and what?
Echo eternity or encourage others.
Well, I think the most important thing is just to pay attention to the people around us, right? And sometimes when you may, and like I'm guilty, you've seen that, like my mind goes a lot, like a mile a minute, always something, and then that connects to something, and then whatever. And when I am able to be in the moment and recognize that somebody is in need near me, you take that moment and you pause and you be together with that person and you just see what they need. And I'll just a funny anecdote that's sort of in that, it's a long time ago, 15 plus years ago. I was on a ski slope with my friend Alice. She wanted to try snowboarding, and we went up. It was a green hill. It was supposed to be, it's not steep, but it was very long. And, every 4 seconds she would fall, and each time, the impact on her bottom was getting more and more frustrating, and eventually, she just didn't want to do it anymore. We took off the snowboard, we went off under the trees, and we just sat there, and she cried, and then we walked down the mountain, and that was the end of her day. And there were moments where I was kind of like, I don't get to ski that often, however much the ski lift tickets cost. But I don't remember all the ski days where I skied more runs than that day. But every time I see Alice, that's a moment that we will share our whole lives. We're just like, all right, you had plan A, and plan A was a good plan, and you were going to do that. But then there's a time where you see that someone needs you, and just be there with them.
That is so beautiful and powerful. Thank you for sharing all of that. And I'm just having a memory. I only ever made it past the bunny hill when I would go skiing. So I could, yeah. Thank you. It has been so beautiful to hear your thoughts and to see you again. This is my first time seeing you. I know it's over the internet, but still to see you after so many years. Please give Carly a big hug from me and my mom. And thank you for taking the time to share your wisdom and to connect. It has been truly wonderful to hear from you.
Thank you for putting together this great program, and for inviting me to be a part of it. And what's Noah up to these days other than editing your show?
Yes, right now, Noah, he's applying into radiology tech school, but it's a lottery system. And so he's dependent on if they pick his name or not. And so my dream is for him to be in full-time editing mode with me someday. So far, I have him at part-time, and then hopefully I'll get him fully booked because he's just so talented with his editing skills and ordering me things like this new mic setup. It's the first time trying this out. But Noah, he is my best friend, and he also loves, my parents just got a dog. It's actually my dog's sibling litter mate, and it's my oldest dog's younger siblings. They're 7 years apart. And so Noah's got his hands full with a 1-year-old puppy named Besame.
Nice.
Yes.
Cool.
I will tell him that you say hi, or he'll see you say hi on this.
And definitely give my love to your parents. And so where do they live now?
Thank you. They're in Albuquerque, New Mexico. And my mom is actually watching my dogs a few rooms away, keeping them quiet so that I could talk to you. So she's leaving tomorrow. She's visiting me for a bit. She was here for the season 2 podcast party to help me put that on. And so she sends her love to you.
Can I just be honest? I don't know where you live, Hannah.
It's okay. I am a healthcare SLP traveler in San Luis Obispo, California right now. So we're not that far. I almost drove to you.
Well, this changes everything. I'm going to go to Santa Barbara next month for one of my old professors is retiring. There's a thing, and I'll go through slow. And I actually might even book a gig. I still have to figure out the details. One of my old friends, we used to work at a pizza place together. Her partner has some gig with a surf rock band. And I actually just got this acoustic guitar because my old one, the electronics on it failed. And so I got this guitar, and I was like, maybe I'll book a gig. And so that might happen on April 20th. And so if you want to come down to Santa Barbara, you can.
Yeah. Thank you.
If you're doing your thing in slow, I think I'll sort of be kind of passing through there, and maybe we can arrange to have breakfast or something, maybe on the Sunday.
Yes. I would love that. I'm going to write that date down in my hourly planner so I don't forget and I don't miss it.
How long have you been in slow?
I started my first contract with this district September 2022, a month into the school year. And then they asked me to come back. So I renewed this school year as well. And so I'm away from here during the summers. And I just love it here. This is a dream come true to be in SLO. The dance community is incredible. It feels like a Hallmark town. I don't need to watch Hallmark anymore. I'm living in it. Everyone's so friendly.
Totally. Well, then you'll be also familiar with the pizza place that I used to work at. I worked at the one in Santa Barbara, but there's a Woodstocks in SLO too. So
yes, that is delicious.
So
no way.
Pizza, a skill I hold to this day.
That is so neat. Oh, I'm so happy that I'll get to see you in person soon.
Me too.
This is awesome.
Great.
Got to bring the mic with us wherever we go.
I'm down. Right on. Well, we'll go for a walk
you.
with the dog. Maybe I don't think, Woodstocks isn't really right for breakfast, so we'll have to find some other place or whatever you prefer. Anyway,
thank you.
I said, thank you again for having me. It's so cool that you have this. It's just a great way. It's a great way to not only catch up, but just to think and to reflect. And so I'm very happy that you're doing this. And
thank you.
Having sort of just watched you grow up a little bit from afar. I know we don't talk very often, but I sort of keep track and very proud of you and very grateful to know you and your family.
Thank you. You warm my heart. It always feels like you never miss a beat when I talk to you or see you. You are so kind, and I love seeing pictures. I see you and Carly and your kids, and I love being able to see you guys. And thank you for all of your words and kindness.
Thank you, Hannah.
You're welcome. Have a wonderful evening.
Bye-bye.